Rod Hill lying down on the job.
I'm dying over here.
More exercise for Mr. Rodney? We are talking about actually exercises for arthritis pain. So we said, who among us suffers from a little arthritis? That would be Rod.
Yes.
Nancy Causton joins Kathy and I on the couch here this morning. She's a physical therapist with Impact Physical Therapy of Hillsboro. So those with arthritis exercising perhaps a little differently from those who don't have it. The difference is?
So the difference is that you need to start where you can, right? So for instance, Rod was doing squats earlier this morning and he was complaining of knee pain. So maybe that's not the best place for him to start. Maybe he needs to start with a non-weight bearing exercise, something that's lying down where he can do the exercise without pain.
Is there most common areas on the body where the arthritis really affects people?
So arthritis affects about 27 million Americans. Most common is knees, then hips, spine, and hands.
Those are is that actually the order?
Pretty roughly.
Okay.
Well, let's get Rod moving over there.
Okay. Kim is helping me out, by the way. What am I doing, Nancy?
So, so to build muscle strength in the core, the hips and the abdomen, you need to suck the tummy muscle in.
Oh, there's a lot to suck in.
Help him out.
You can push his belly in if need be.
Push, yep.
It only comes in so far.
And then a side leg lift.
Just up like this?
Up and down. It's going to build strength in the hips.
And hold everything tight.
Right? Going to support the hip joint.
Hold my core tight, Kim's telling me.
Yes.
Okay. All right.
And then it doesn't hurt your knees.
That doesn't hurt at all.
I know.
Can I ask you a question on your behalf, Rod? Because you were complaining this morning, Rod, in the morning meeting that sometimes you wake up and your fingers won't even cooperate with. If you had to open up a bottle at the very start of your day, you might not be able to. Is that true?
Right. No, it takes me a while, if I feel like, Nancy, for my fingers to wake up. Does that make sense?
Yeah, that's true. That's one of the signs of arthritis is that morning stiffness. So the important thing is to keep the body moving during the day.
What can we do for Rod's hands in the morning? Is there a trick, or is it not going to be something that's like a cure fast at that time of the day?
So there is no fast cure, but the consistency is the important thing. So doing a small amount of exercise regularly throughout the day, plus maybe doing something in the evening time to keep the hands loose. Heat is really nice too.
And he's stretching like this.
Yeah, I mean, does this help just to get my fingers moving, or no?
As we love to say in our business, motion is lotion.
Motion is lotion. Okay.
All right, let's get him some more lotion over
yeah.
there.
What am I
Keep
doing
moving.
now?
What else can he do?
All right, side planks. So back down on your side again.
Back on that side. With my weight on my elbow, right?
Yes, sir.
Is that not supposed to hurt?
And
pull your core
weight
in.
On your
Okay.
heels or your.
We still see your core,
Lift up
Rod.
your
Pull it in.
I'm lifting at my hips. You mean both of them?
Yes.
Like this?
There you
Yes.
go.
Oh, look at that.
This is putting a lot of weight onto my arm, is it not? My elbow?
Exactly. So then the modification could be you could bend your knees
Bend my knees.
a whole bunch.
A whole
Get
bunch.
out there,
Into the fetal
Kim.
position.
Like
There
this.
you go.
Okay.
Now lift.
Now lift.
It'll be
Just
easier.
Lift up your hips.
Oh, that is easier.
Yeah.
Oh, it doesn't.
what's
It
that
takes the
doing,
pressure off of my elbow.
So there's always a modification
All
for
right.
exercise. That's the important thing, is that when you work with a physical therapist, we can meet the needs of really anybody. Anybody can start with a kind of exercise, right? We could have him use his hand. That would make it even a little easier, right?
I like to talk about, how often these things in terms of getting a benefit. So those couple of exercise, how often would he need to do those to really notice a difference?
So we really encourage people to exercise daily, right? Some form of exercise every day of the week. Now, it doesn't need to be, as we talked about earlier, 60 minutes, because maybe that's overwhelming. But a 10-minute walk, followed by a few simple weight-bearing exercises or non-weight-bearing exercises to help you get started. And then you build on that. So everyone's exercise program should change over time, right? It's as you gain strength, your exercise should change.
Well, we've given Rod a good start this morning, I think.
It again is Impact Physical Therapy of Hillsboro.
Correct.
If you want more information, we have a website right there on the screen, impacthillsboro.com. Check them out for all of your physical therapy needs, including those of us with arthritis.